We need to fund critical research into the area of health enhancement and health education. And another thing that doesn't happen is sometimes the new drug comes out as if it were better, and most of the time it's just a Me Too drug that's just more expensive, and it doesn't do anything better than one of the older drugs, and it has more side effects. Finally, the last point, it's just a pet peeve of mine. National Clinical Trials Registry to assure when negative trials can't be hidden. Just to, again, to show you, unfortunately, what happens when you put market pressures and profits at the top. The Paxil example. I'm just going to read this. When the manufacturer of Paxil performs 9 clinical studies on the treatment of adolescents for depression and finds it is no more effective than placebo, and in fact significantly increases the risk of emotional lability, which includes suicidal thoughts and attempts, it's no problem. The company publishes 1 study that shows benefit, fails to publish the other 8, and markets away. When the British drug authorities spill the beans, no problem. An American task force pronounces that it's safe. Too bad that the task force lacked information, namely that 9 of its 10 members had industry ties. So I'm not against medication. I think medication can be used appropriately. I think it can be very helpful. But I think it's distracting our attention away from the real issue, which is healthy behaviors and the cultivation of healthy behaviors, and that begins really in the schools. To me, we need to be teaching health education as a #1 thing in schools, because that's where all of our habits begin and where all the prevention can be most effective. And so anyway, that's just one facet of my message. Thank you.
And finally, we'll hear from Jane Burns. Evidently, Jane has walked in.
So my name is Jane Burns. I don't think they saved the best for last. I am a registered dietitian and a certified personal trainer. I have premonitions from these presentations. Walt said that the benefits of diet and exercise must be stressed at all ages. Ron said the same thing. We've got to take another look at the issue of health as it is marketed to us. Health on TV is a matter of taking drugs. Health in hospitals is a matter of taking treatments. Health in election situations is a matter of affording insurance for all those treatments. They're very expensive. Healthcare is a very, very expensive proposition, but being well isn't. Being well is cheap. What being well is cheap. You know, none of the 3 of us have services to sell. That's kind of unusual. Isn't that right? We're not selling you any pills or powder or any products at all. We're saying, let's figure out another way to deal with health care. The target on my handout is consumers. It's not a professional level handout. There are no footnotes. But prominently toward the bottom of one of them, of the front pages, eat less, move more. Now, that's not a message that plays well in America, right? We're supposed to eat more, and do, less. But in fact, 96% of healthcare costs are spent on taking care of sickness, and only 4% on prevention. Per person, my statistics were at least theoretically for 2007. America will spend $7,000+ on sick care per person this year, and nearly twice that, $12,000 a person by 2015. Chronic diseases now cause two-thirds of the deaths in America and absorb 80% of healthcare dollars. 60 to 80% of current healthcare costs are due to individuals' lifestyles, choices that happen far away from doctors' offices. Diabetes is an outstanding example. When you go and get that diagnosis, it's kind of a fuzzy diagnosis. Well, you have pre-diagnosis, you have pre-diabetes. And then over the next couple of years, you get medicines phased in, and they're all expensive, all of those treatments. So much so that this January, the American Diabetes Association announced that the cost of care for diabetes is now the same as paying for Iraq, Afghanistan, and the global war on terror every year. And yet routine and preventative costs are very small compared to those massive costs of the complications of diabetes. Isn't it wise, isn't it smart to pay more for preventive services? Is that not where the smart money should be? To illustrate that our focus on illness happens in from many directions in the United States, and it has many, many potential causes. Hospitals, for example, could refer all the folks who are terminal to the loving arms, to the comfort care of hospice, and cut the prices dramatically. The last time I was involved with an elderly woman's death, her death was delayed for 2 weeks. She suffered for 2 more weeks while she was on antibiotics for a terminal condition, breathing treatments, suffering greatly the whole time. The family was stressed out to the max. Why not comfortably relieve her pain, hug everyone, say goodbye, and leave, as opposed to going out hooked up with lots of bells and whistles. Expensive to every one of us. Extended her suffering, stressed the family enormously, and cost every single one of us a great deal more money. Doctors can give it up. They can stop all that marketing, believing that marketing, the marketing that's really misrepresented, as sometimes researched, fuzzily presented, that they can get beyond pills, that they can get early definitive diagnoses for chronic diseases. That's high blood pressure, type 2 diabetes, stroke, heart disease, breathing conditions, cancer. Be honest with those diagnoses, and at every single opportunity, every single appointment, give motivational counseling and education, such as evidence-based nutrition, physical activity, weight loss, cessation for smoking, alcohol or drug abuse, and do it every single time they see a patient. I'm just going to cherry pick so that I can stay within my time limit. Facilities with children, not just schools, but all facilities that deal with children. I work for the YMCA, and when I suggested to them, why don't you try birthday parties without cake? My hair was on fire. Their jaws dropped. But in fact, we reinforce the celebration of every event with sugar and other kinds of food rewards. We might change from any kind of food reward, even that read a book and get a pizza reward that's very effective, with